In this concept video, you will learn about the cardiac cycle. You should recall the structures which you have learned regarding the different parts of the heart. Here is a revision of the route which blood takes when they are being circulated around the heart. In the cardiac cycle, there are several events, changes in volume and pressure of the different parts of the heart, leading to an opening or closure of different heart valves at different times. Essentially, we want to focus on ventricles undergoing contraction and relaxation, as that is what powers the movement of blood around the body. The cardiac cycle, as such, can be classified into three stages: ventricular contraction, ventricular relaxation, and atrial contraction. Thus, we shall focus on ventricular systole and diastole to find out what happens to ventricular pressure and volume when these stages occur. During ventricular systole, which are the shaded regions, there is a steep rise in the pressure of ventricles. The left graph shows pressure changes in the left hand side of the heart, while the right graph shows pressure changes in the right hand side of the heart. When the ventricular pressure exceeds the pressure of the atrium, atrioventricular valves close to prevent the backflow of blood, shown by point 1. When the ventricular pressure further exceeds aortic pressure, semilunar valves will open to allow blood to flow, marked by point 2. Since between points 1 and 2, all the heart valves are closed, the ventricles will not change its volume during the time period, otherwise known as isovolumic contraction. After semilunar valves open at point 2, blood rushes to both the systemic and pulmonary circulation, leading to the ejection of stroke volume as shown between 2 and 3. During ventricular diastole, which are the shaded regions, there is conversely a fast drop in the pressure of ventricles. When the ventricular pressure falls below the pressure of the aorta, semilunar valves close to prevent the backflow of blood, shown by point 3. When the pressure further falls below atrial pressure, atrioventricular valves will open to allow blood to flow, marked by point 4. Since between points 3 and 4, all the heart valves are closed, the ventricles will not change its volume during the time period, otherwise known as isovolumic relaxation. After atrioventricular valves open at point 4, blood rushes to the ventricles, leading to ventricular filling that takes place after point 4.